WPEC News 12, CBS. Now, from the one to turn to for news and Doppler 12,000 weather. Live, this is News 12 at 5.
Colleen Gallagher in medical news. Does the term root canal make you shudder? Well, it might not after I show you what one local doctor is doing with a new procedure to make it pain-free.
Microscopes have been used in medicine for 75 years, but only in limited areas until now.
Some local doctors are using operating microscopes to bring dentistry and endodontics into the 21st century. We turn to News 12's medical reporter Colleen Gallagher for more on a new procedure. Colleen?
Well, if you're like most people, even the words root canal conjure up painful images in your mind. But that's not the case for patients of a local doctor who's using the latest technique to make going under the drill pain-free and more effective. Until recently, Deborah Marin dreaded having to get into this chair to have a root canal.
You felt a lot of pressure when you left that night. You had to take something for the pain.
Now she takes comfort knowing today's visit will be a breeze, despite what it looks like.
This is my second one with Dr. Mortman. Didn't feel anything the first time.
Dr. Rory Mortman and his partner Julie Kennedy are two of only a handful of endodontists in South Florida who are using an operating microscope to revolutionize root canal procedures.
Inside every tooth there's a nerve, and the nerve is protective in nature. It helps the tooth form when it comes into the mouth, and after it's formed it can also help build tooth to fight decay. But once the nerve gets infected, it has to be removed.
Endodontics literally means working inside the tooth, and root canal involves going inside the tooth to remove those infected nerves.
In the past, the dentists relied on feel, tactile sensation, which is the predominant thing that I was even trained on by endodontists.
The new way to do it is with this, an endodontic microscope that turns tiny into big, really big.
Now we can make the tooth look about the size of a car. It allows us to see and clean everything more efficiently, and it is a one-visit technique.
By expanding the field of vision, Dr. Mortman can pinpoint exactly where he needs to put the drill. It saves time, but more importantly, it prevents dread and pain for the patients. And Dr. Mortman tells me that Nova University's School of Dentistry is now teaching this technique here in South Florida, so it should be more readily available in the near future. For the one to turn to for medical news, Colleen Gallagher, News 12.
News 12 at 5:30 begins right now.